cocaine addiction forms and risks. If you even suspect a loved one of cocaine addiction, it is better to take action and find out you were mistaken than not take action and find out they are addicted. The consequences can be very serious. So, how do you tell if a loved one is in the throes of cocaine addiction? There are many different ways of taking cocaine, so the obvious symptoms differ. It can be snorted, ingested, smoked, or injected. Snorting cocaine, also known as freebasing, for example, can lead to the loss of the sense of smell, nosebleeds, problems with swallowing, hoarseness, and a chronically running nose. A sure sign is someone who is constantly sniffing. Snorting is a highly dangerous way of using it as the cocaine reaches the brain within seconds, resulting in an intense high, but the euphoria quickly disappears, making the addict increase his use. Smoking cocaine is probably the worst cocaine addiction there is and is considered to be the most addictive. Signs of use, however, are not that evident other than increased jumpiness, irritability, or even paranoia. Ingesting cocaine can cause severe bowel gangrene due to reduced blood flow. This is more difficult to tell, but if a loved one suddenly starts having bowel movement problems, abdominal pain, and nausea, consider cocaine addiction as a possibility. Those who inject cocaine can experience severe allergic reactions and, as with all drug users who inject themselves, they are at risk of contracting HIV and other bloodborne diseases. This is easier to detect than those ingesting it as there will probably be visible needle marks. Cocaine addiction leads to disturbances in the heart rhythm and can lead to heart attacks, chest pains and respiratory failure, strokes, seizures, headaches, and gastrointestinal complications such as abdominal pain and nausea. Cocaine, having a tendency to decrease appetite, chronic users can become malnourished, which compounds the problem. Binging on cocaine can lead to increased irritability, restlessness, and paranoia. Paranoia is a sure sign that the user is smoking or snorting. Cocaine addiction can even lead to full-blown paranoid psychosis. Whatever you do, don't let be put on antipsychotics because you will be switching them from a cocaine addiction to an antipsychotic addiction plus the possibility of reversion to the cocaine as well. Dealing with cocaine addiction is rather simple if you know what to do about it. The first thing is to get them onto a program that does not give them further drugs and can help them through withdrawal in the most effective and comfortable way using the correct vitamins and minerals that their already depleted body needs. There is a very specific method for handling cocaine addiction withdrawal that does not make them feel awful. Once they are through the withdrawal, a good program would consist of getting the drug residuals out of their body in the safest and most effective way. While they still have the drug residues in the body, they cannot think clearly and have low energy levels, making it impossible to grasp and understand the data they will need in the education part of the program. Only after they have gotten rid of the drug residues in their body on the detoxification step of the program are they ready to continue with the rest of the cocaine addiction rehabilitation program. The key things to look for in any cocaine addiction rehabilitation program is 1. Comfortable, non-drug withdrawal, 2. A full detoxification program that rids their body of all the drug and toxic residues, and 3. An educational aspect with the person being able to establish for himself why he became addicted in the first place and then working on the solution he has figured out from the education steps.
For more content like this, please visit learnforfree.biz.
Content produced and distributed by AllSuperInfo. All rights reserved.
Discover the proven formula for automated sales and success that you can apply to your business in under 30 minutes.
Reserve your seat at allsuper.info/webinar.